Hello, everyone. My name is Gabriela Castillo, and I am here representing Health Outreach Partners, where we oversee and lead our training and technical assistance and consulting activities with health centers and partner organizations, particularly focused on outreach by supporting and partnering with health centers and safety net health organizations nationwide to increase access to health care, particularly focused on farm workers and their families.
Good afternoon. My name is Mayra Reiter, and I have worked as program coordinator with Farmworker Justice's health programs since 2019, supporting its various health initiatives and online research efforts. I also hold a master's degree in international service from American University in Washington, D.C., and a joint master's in environmental sciences and public affairs from Indiana University.
Hello, my name is Hannah Mesa, and I'm a program director with MHP Salud. I'm actually located in our Tampa, Florida office. I also have a master's in public health and public policy, and I'm excited to be here today.
Hello, everyone. Good afternoon. I'm Alexis Laboy. I am the Health Education Coordinator and Certified Health Education Specialist at NCFH, and I work on developing a variety of patient educational materials and resources on topics including social determinants of health, patient education, and development of educational materials for the agricultural worker population. I hold a Bachelor in Science in Premedics from the University of Puerto Rico Maya West Campus, an MPH from San Juan Bautista School of Medicine, and a Master in Public Health Education from the University of Puerto Rico Medical Sciences Campus. Thank you very much.
And I'm Theresia Lyons-Clampett. I am, the Senior Program Manager at Migrant Clinicians Network, and I provide the day-to-day management of the Health and Resource Services Administration National Training and Technical Assistance Program and all the related activities. So we're very glad to see you here today.
Thank you, everyone. And as I mentioned when we began, my name is Gladys Carrillo. I'm the Director of Program Services at the National Center for Farmworker Health. I'll be one of your speakers as well as your moderator this afternoon, and we welcome you to today's panel. Gabriela?
Thank you, Gladys. Next slide. And so just real quickly, we make up the organizations here today, make up the Farmworker Health Network, and this is who represents us and the folks who just introduced themselves. Next slide. And so this presentation will provide an overview of best practices in screening and documenting social determinants of health among migrant and seasonal agricultural workers at health centers. Attendees will learn about prevalent social determinants of health factors impacting this population and how such factors affect the health outcomes of migrant seasonal agricultural workers. Next slide. And so this information was gathered from our Farmworker Health Network, Social Determinants of Health Screening Tool Learning Collaborative, which took place in the course of 7 weeks and just ended earlier this month. We had about 21 health centers that partook in this 4-part series that gave an overview of current existing social determinants of health tools that captured and helped address the following topics: transportation, housing, and food security. And it provided an understanding of how these barriers influence their health outcomes and offered opportunities for health centers to share and discuss strategies that can increase how health centers screen for these particular social determinants of health. Next slide. So to provide a quick overview, social determinants of health are conditions in the environment in which people are born, live, learn, work, play, worship and age, and really just where an individual spends their time in during their lifetime and how it affects a wide range of health functioning and life outcomes and risks. So when referring to environments an individual is affected by, this includes lifestyles, community networks, and cultural and physical environments that lead you to behave in a certain way in response to them. And so, and this is tied to resources that are part of someone's livelihood, like income, education, and housing security, as to name some examples that are not traditionally seen as part of the healthcare system, but all impact the person's health outcome. And so, excuse me, and so as public health workers, we know that health outcomes are driven by factors such as underlying genetics, health behaviors, as well as social and environmental and cultural factors. And so the healthcare system, as we traditionally know it, is not the only key driver of health and health outcomes. So, for example, children born to parents who have not completed their high school education, which is the social factor, are more likely to live in an environment with limited opportunities, limited income, limited housing options, which can promote barriers to health, such as lack of safety, exposure to toxins, and substandard housing. They're also less likely to have access to sidewalks or parks or recreation centers or libraries, making them more susceptible to subpar living opportunities. And so addressing social determinants of health is not only important for improving overall health, but also for reducing health disparities that are often rooted in social and economic disadvantages. Social determinants of health act like a chain reaction. One factor has an impact in another, and so on, resulting in a certain way of living. Next slide. And so what we see here is that the social determinants of health are often grouped into 5 domains, and they include healthcare access and quality. And so this is the connection between people's access to and understanding of health services in relation to their own health. The domain includes key issues such as access to healthcare, access to primary care, preventative care, health insurance coverage, and health literacy. We also have economic stability, the financial resources people have, and that looks like income, cost of living, and socioeconomic status in relation to their health. So social issues here include poverty, employment, food security, and housing stability. We also have education, like mentioned in the earlier example. We know that with less education, an individual poses greater risk of negative health outcomes and overall well-being. And so key issues here are graduating from high school or educational attainment in general, language and literacy, and early childhood education and development. We also have the social and community context, and this includes the characteristics of the context in which people live, learn, work, and play, and their connection to that individual's health and well-being. So topics here include cohesion within a community, civic participation, discrimination, conditions in the workplace, and incarceration, to name a few. Lastly, we have our neighborhood and built environment. And so this connection is where a person lives, such as their housing, their neighborhood and environment, and their health and well-being. And this includes topics like environmental toxins, like pollution, quality of housing, access to transportation, availability of healthy foods, and neighborhood crime and violence. Next slide. So why does this all matter to health centers? Ultimately, our goal is to reach health equity so that everyone has the opportunity to obtain their full health potential, regardless of their circumstances, which include economic, social, and cultural factors. And given the roots of the health center model and focusing on those who are most impacted by inequities that result in health disparities, it's crucial to support health centers in understanding social determinants of health and what those look like for their patients, their families, and their communities. Next slide. So how do social determinants of health affect agricultural workers? Agricultural workers already face a number of challenges given the nature of the work they do. This includes limited school, low literacy levels, as well as economic stability given low wages, where 83% of agriculture workers are paid by the hour with an average rate of $10.19 an hour. 10% of agriculture workers are paid by the piece, 4% are salaried or paid by other needs, and where 48% of agricultural workers and their families report using need-based services. Overall, 30% of agricultural families reported incomes below federal poverty level. This puts a worker in the predicament of having to choose between paying for health care and meeting their essential basic needs like housing and food access. Depending on an agriculture worker's employer, labor policies also impact their health outcomes like paid sick time or time off in general, or even having low wages in which workers are barely able to make ends meet and highly discourages them from taking time off to seek the health care they may need. This also includes community and workplace barriers like building relationships with a trusted provider due to their migratory nature, or lack of awareness of resources available to them, which promote limited access to health care. Next slide. And here we see some more barriers that we identified. Migrant and seasonal agricultural workers tend to lack health insurance, which forces them to seek medical care only when absolutely necessary. Preventative care may not be a priority, for example. There's also the lack of knowledge of how the U.S. healthcare system works, how to navigate that system, and the resources available, often leading to solely relying on their culture's homeopathic remedies, impacting their healthcare needs. Their citizenship status may also drive them to opting out of care and services for fear of deportation. Furthermore, neighborhoods and environments they live in often threaten their health and pose a significant barrier to accessing healthcare. Transportation is a constant barrier where farms are located, which are mostly rural locations, and can make it an easy transportation desert where they're located. Housing may also be inadequate. Some live in the field, self-made shelters and cars, camps, etc. Next slide. We also want to know that these are what are traditionally known as social determinants of health impacting agricultural workers, but we've seen how this has been highly disrupted by COVID-19, which has resulted in lack of work, lack of public transportation options and access, and accommodating in-home learning for children that has only amplified increased social disparities for this community. So many of our farm workers have been unable to quarantine since they have lived in crowded, unsafe housing, have been isolated geographically, and are may experiencing potential exposure to coronavirus. So due to the quarantine and reduction in staff, there's minimal access to transportation services, and people have been getting creative on how to address that barrier. There is also lack of childcare due to social distancing. There is in-home schooling, which has promoted the lack of adequate education and nutrition programs for children who have relied on school food. And in a time in which we are highly relying on technology for healthcare, there is also the lack of or limited access to technology and digital literacy among this community. So this creates a lot of uncertainty for our ag workers to be able to access the care that they need. Next slide. I will now pass it on to Mayra to talk about some of our social determinants of health tools that we bring forth to address these issues.
Good afternoon again. I am Mayra Reiter with Farmworker Justice. I'm going to talk a little bit about social determinants of health screening tools, as well as best practices that have been implemented by health centers. Next slide, please. So first of all, why collect standardized social determinants of health data? Health centers have focused on social determinants for decades since their inception. What has changed now is that health centers are collecting standardized data on the social determinants and enabling services to help the population they serve. The push for standardized data largely comes from the transition to value-based pay models, where organizations are responsible for improved outcomes at lower costs. It is hard to do this without fully understanding your patient population and addressing their needs. With standardized data, health centers can do the following. At the individual and community level, social determinants of health data can help you identify and address top social needs of highly vulnerable groups at risk for COVID-19. For example, individuals experiencing homelessness, food insecure individuals, and the unemployed. And target outreach to these groups in collaboration with the social service sector, such as food banks, homeless shelters, and job assistance organizations. Also, at the individual level, they can better understand their patients and provide appropriate care and treatment plans that meet the patient's socioeconomic circumstances. For example, if a provider knows that a patient has issues with refrigerations because of problems with their utilities, they may not prescribe a medication that requires refrigeration. At the population level, social determinants of health data can help identify patients at higher risk of complications, hospitalization, or death due to COVID-19. And this is done through risk stratification. Patients with high risk are identified using social risk stratification. For example, if they have comorbid conditions or compounding social barriers. And these patients can be targeted for outreach. For example, by checking in with patients to inform them of their high-risk status and providing resources and social referrals. At the organizational level, with standardized data on their population's socioeconomic needs, health centers can better design care teams and services to better manage their population needs. At the system and community level, health centers can inform the establishment of cross-sector partnerships to provide needed care and services. And at the system and policy levels, the data can help pinpoint trends regarding how the virus is disproportionately impacting certain groups with social risk barriers. At the payer and policy levels, health centers can demonstrate their value to the healthcare system by showing how complex their patients are, how their model of care and services work to address non-clinical needs, and what kinds of payment and infrastructure models are needed in order to make this work sustainable. These are some examples of commonly used screening tools that we discussed during our Social Determinants of Health Learning Collaborative. The first is the PREPARE tool, which was developed by the National Association of Community Health Centers. And this tool is research-informed and evidence-based. They hold national core measures for community priorities and align with prioritizing social determinants according to the Healthy People 2020 initiative. It is available in 26 languages. The Accountable Health Communities Screening Tool by the Centers for Medicaid and Medicare Services aims to undo the harm of social determinants of health factors. It tests systemic findings and deals with health-related social needs of Medicare and Medicaid beneficiaries. This tool is only available in English. The National Center for Farmworker Health has developed these two specific tools you see here. One is a self-assessment tool for health centers to evaluate their social determinants of health screening practices, and the other is a patient screening tool with an action plan. Family physicians understand that it is important to identify and address social determinants of health for individuals and families to achieve optimal health outcomes and whole person care. The challenge is implementing such a large task in a busy practice environment in a manner that is actionable and practical. The Academy of Family Physicians is providing resources that you can customize to your individual practice, population, and community needs. These tools are intended to be useful to health center teams. The first is a guide to social determinants of health screening. This guide outlines the importance of screening for social determinants of health and the rationale for the questions included in the screening forms. The social needs screening tool screens for 5 core health-related social needs, which include housing, food, transportation, utilities, and personal safety, using validated screening questions, as well as the additional needs of employment, education, childcare, and financial strength. The Neighborhood Navigator helps with access to community food, healthcare, financial assistance, transportation, and other resources to help your patients with their non-clinical health needs. A quick form to guide a discussion with your patients about their social determinants of health and to document a plan to address them. This form is available in 7 languages. Next slide, please. In developing an appropriate workflow for social determinants of health screening, health centers need to consider who will be administering the screening tool. This will affect where the screening occurs. For example, is it done in the waiting room, the exam room, or the office of the care coordinator? That will also affect when and how the screening tool will be administered. Health centers need to weigh the pros and cons of each approach. The who, where, when, and how the screening is being done. Next slide, please. During our conversations with the health centers that participated in our learning collaborative, they identified a number of goals they had for their social determinants of health screening activities. They included collaborating with other agencies to avoid duplicating efforts, solving problems in administering the screening tools, expanding or adapting an existing tool to capture new needs, and learning about available resources, engagement tools, and outreach strategies. Next slide, please. In these conversations, health center staff also indicated some factors they found most helpful for screening and addressing social determinants of health. Enabling service staff that can speak languages other than English to administer the tool or questionnaire. Building rapport or trust with the community. Recognizing patterns and trends within a particular community leads to addressing new or other needs. Training all staff to administer the screening tool among patients, and learning how to have an open conversation, because sometimes the screening tools can be very personal. Being able to identify the needed partnerships or resources that best help address barriers to positive health outcomes, and developing referral processes to connect patients to services. Next slide. Some of the barriers health center staff identified included difficulty in collecting sensitive personal information, very detailed and time-intensive forms. Data are sometimes incomplete due to changes in patient circumstances or difficulty with follow-up because of staffing limitations. Infrequent provider visits with farm workers, and adapting to COVID-19 and the challenges of working remotely. For example, in conducting outreach and connecting with patients. Next slide. Best practices to address food insecurity identified during the Learning Collaborative included building trust with patients so they will feel comfortable admitting whether they experience food insecurity, developing community partnerships and being prepared to adapt as those partnerships change. During the pandemic, establishing drive-through markets and doing boxed food deliveries and pickups have been helpful. Creating opportunities for participant input and distributing culturally relevant foods. Next slide. Best practices for addressing housing insecurity included connecting with local resources, including housing and workforce development. Establishing medical legal partnerships with legal aid providers. Addressing the information needs of patients with limited literacy or who are not fluent in English. Setting up a referral process. Connecting patients with federal and state programs or with community-based organizations that work in housing. For example, the Salvation Army, Catholic Charities, and other nonprofits that provide housing assistance. Where appropriate, help patients report on safe housing conditions to the proper authorities. Next slide. And finally, health center participants helped us identify these best practices for addressing transportation barriers. Tracking missed appointments, modifying hours of operation to allow people with transportation barriers more flexibility, connecting with the state Medicaid program for transportation benefits, partnering with ride-share programs, developing strategic partnerships with other transportation services within farms, adopting volunteer driver models. If funding allows, using mobile clinics or vans, telehealth appointments, and lastly, utilizing social media and other modes of communication for outreach. I will now hand it over to my colleague, Hannah Mesa, who will talk about the role of community health workers.
All right. Hello, everyone. So that was a great introduction into what we'll actually discuss next, which is how community health worker programs can really benefit or improve screening for social determinants of health. So you'll see on the slide this visual that's also from Prepare. So hopefully, you know, that's a familiar name for you by now. But what we want to discuss and look at is not so much what are social determinants of health and how do they impact specific barriers such as housing and things like that. But we want to look at, well, what does that process look like when we actually implement it, especially at a health center, right? So if you'll go ahead and click that, we'll stay on this slide, but it'll give us a nice little visual. Perfect. So we're going to focus on this third bubble with the right people. So we kind of discussed, right? Social determinants of health, they're important, but they also might include sensitive information. So when collecting that from patients or potential patients, right? Maybe you're doing an outreach, and this is the first time you've kind of spoken with these community members. Well, how do you ask this information? What does that look like? What if a patient or potential patient does not want to disclose this information on that first meeting? And also, who should be the person to facilitate that, right? So for example, you might know that there are several barriers for your migrant farm worker patients to receive care. and you likely know what some of those barriers are. But let's say that you want to understand those barriers a little bit better so you can connect with this population and provide more consistent care, and maybe even enroll some of those patients in your programs, like your diabetes management program or new mom group, for instance, right? Well, how do you collect information that would help get your patients to that point? And who is the contact person, or who is the point of contact to facilitate that? Well, I think when we talk about communities where language might be a barrier, or the circumstances people might be in are sensitive, we need somebody who's a trusted member of the community, right? And if we're talking about our migrant farm workers, naturally, that's likely somebody who speaks a language of the farm workers, right? So Spanish is a big one, but we have other ones, right? And also somebody who can connect with that person. Next. Great. So in this space, we like to think of that trusted member as a community health worker, or some of you might know this as a promotora de salud. So community health workers are trusted members of the community who empower their peers through education and connections to health and social resources. They're also widely known to improve the health of their communities by linking their neighbors or community members with health and social services, educating these peers about disease and injury prevention, and working with health services to make those more accessible, and then ultimately to mobilize communities to create positive change. Apologies, I was going a little fast there. So awesome. So given that description of community health workers, right, we see natural, unique talents that can be really beneficial to connecting patients not only to your services, but also for collecting this important information. So for example, many health centers, already use community health workers or outreach workers to provide education and outreach in migrant farm worker camps. Why do a lot of health centers do this? Because it allows the community to connect and communicate with someone that they trust, right? So when we think about community health workers, they do tend to serve our key populations, those where we need to be conscious of how we talk to our community and in what ways and what conditions. Next. So as members of the community who empower their peers, right, the CHWs, community health workers, they can engage in a wider range of activities to screen and identify for social determinants of health among their patients, right? And so that same screening process that was discussed earlier, we can have the actual facilitators be our community health workers. So that might mean they collect social determinant of health information or data. They're connecting the patients afterwards with those key resources to meet those needs. And then they're educating their patients on risk factors and health alternatives. Next. And you can hit next. Awesome. So, back one more. Thank you. Right. So just to kind of revisit our visual. So we now said, okay, hey, community health workers are a valuable staff member to help us do this work. But how is it actually done, and at what times, what spaces? Next. Awesome. So community health workers can often facilitate patient appointments or care in a flexible and often culturally informed manner. So for example, if your clinic is serving migrant farm worker patients at a mobile health clinic, right? Maybe you're considering paper forms versus an electronic tablet, right? If your medical staff is really accustomed to working with electronic tablets to collect that information, sometimes that switch can be difficult to do on the go. Also, administering screeners at a community site. Often our clinical staff has to stay at some of their clinical sites unless they're able to travel in a mobile unit. So community health workers can also be great when you need additional staff who don't fit some of that clinical care to help out, right? And then, as we've mentioned, community health workers often speak the language of their community, Spanish being a big one, and that helps facilitate care. But they also can help incorporate those screening tools into overall wellness, right? So thinking about that next appointment with your patient and saying, hey, you mentioned that you're struggling with putting food on the table or having enough food for your family. And right now you really need, we really need to help you manage your diabetes. So what does it look like for that CHW to provide follow-up care resources to help that patient meet those food insecurity needs? Next. Awesome. And then just kind of to wrap up the community health worker roles and responsibilities, especially for those who might be new to this role, right? So we mentioned that community health workers have a unique skill set. And so that is the confidence, the trust, the ability to facilitate patient engagement, and then, as we mentioned, the ability to provide that follow-up care or resources that are really crucial to meet these needs. Next. Awesome. So I also mentioned that it's very common for many health centers to have CHWs provide education, right? Health education. And so also thinking about one of the natural ways that community health workers can facilitate follow-up care, right? So when we found out that there were gaps or there were needs, social determinants of health that were impacting a patient's health, our community health workers can step in to provide that follow-up health education that's often one of the most crucial gaps in a lot of patients' care, right? So thinking about what does it mean to spend that extra time that I know that the nurse isn't able to do because our clinic is crazy, right? For example, and even thinking about community health workers facilitating virtual care. Obviously, there are still some limitations to telehealth depending on the community and environment, but we've seen that as that has been more utilized during COVID-19, this is also a natural space to train community health workers to be able to facilitate this care. And then, as mentioned before, being able to give immediate resources when needed to address a health disparity. Next. And so lastly, I kind of want to wrap this conversation up with thinking about identifying those gaps. So we talk about follow-up care because that means that a community health worker or staff member is able to say, hey, my patient might not be able to come to their appointment because they don't have a ride, right? And so there were some great examples of best practices mentioned before, so a lot of this is incorporated into that. But some of that service and that care delivery can even be providing or helping facilitate clinic transportation, right? There are some clinics that have that capacity. Maybe it's even administering that care via mobile clinics, like we mentioned. Maybe there are vouchers or certain things that community health workers can help connect patients to. And then lastly, I know it's a big goal for many health centers, really finding ways to develop strong virtual care and outreach when possible. Next. Great. So as we kind of end on this note, we're going to end on the social determinants of health slide here. So you can go ahead and just slowly click one by one and I'll introduce the topics. Awesome. So we already kind of know what we're working with, but what does it look like for a community health worker to be working in this role? Well, with education access, for instance, community health workers are great at providing that information or health education in an educationally equitable manner. Meaning that community health workers might say, hey, it's okay if you don't know what the A1C level is and glucose level and all these terms. Let's break it down. Let me explain to you how it impacts your health and let me know what questions you have. Conversations that, our medical staff would love to have, but often are limited by time. Next. Another aspect we covered on the last slide is providing patients with vouchers or other resources that they might need. Next. We also discussed collecting social determinant of health data in the language of the patient to meet them where they're at. Next. We also spoke about community health workers being able to facilitate care in the community, such as through a mobile unit, because they're already comfortable with working in those spaces. Next. And then lastly, we discussed the connecting patients to health services, referrals, or other care, which is a crucial part of care delivery and continuity of care in general. Next. Great. And so now with that, I'll introduce my team at NCFH.
Okay, thank you very much, Hannah. Okay, I want to make sure that you are able to see me and hear me. Perfect. Okay. So thank you very much and good afternoon again. Thank you for joining our afternoon SDOH panel. My name is Alexis Laboy from the National Center for Farmworker Health. So through this virtual roundtable discussion, the National Center for Farmworker Health will share results and tools shared from the Increased Access to Care Plus Learning Collaborative. This is a learning collaborative from NCFH, of the National Center for Farmworker Health, and the Farmworker Health Network, SDOH Learning Collaborative, on the current practices and challenges health centers have faced in implementing the social determinants of health screening tools in order to better serve the ag worker population. Next slide, please. So before moving on to the main topic, I would like to give a brief introduction or background about the National Center for Farmworker Health. And for those of you who are not familiar with the National Center for Farmworker Health, we are a private nonprofit organization located outside of Austin in Buda, Texas. Our mission is to improve the health of farm worker families. And we do that in providing programs, products, and services that support our mission. We just celebrated our 45th year anniversary in 2020 and are very proud of being able to serve 174 migrant and community health centers in our network who provide primary care services to agricultural worker families. Next slide, please. So the learning collaborative that we're going to talk a little bit more about is called Increased Access to Care Plus. This is a learning collaborative led by me. So the Increased Access to Care Plus is derived from our Increased Access to Care Core Learning Collaborative, and this one addresses social determinants of health in order to increase that access to care for the migratory and seasonal agricultural worker population. So it focuses on helping health center staff effectively identify and document the social determinants of health factors to enhance that service delivery to our population. Next slide, please. So you already saw this social determinants of health screening tools in our previous section, so I'm not going to go over those again, but it is important for you to know that we have 4 different screening tools. So we have the Everyone Project by the American Academy of Family Physicians. We also have the Prepare screening tools by the National Association of Community Health Centers. Next slide, please. We have the Accountable Health Communities, or AHC tool by the Centers for Medicare and Medicaid Services. And NCFH has also a couple of screening, social determinants of health screening tool resources, such as the self-assessment tool and the patient as social determinants of health screening tool and action plan. Now, I am going to add 2 more resources that we were able to develop, and we are continuing working after the Learning Collaborative. So the first resource is called the Social Determinants of Health Checklist, and this resource functions identifying health centers, identifying those social determinants of health factors are currently affecting their population. It's a very simple table or chart, and then you identify those factors, then you link what are the challenges to those factors that are affecting or are becoming a barrier to your population. Then we identify strategies that we can start developing or our health centers are already putting in place to tackle or decrease those barriers. And also it has a section where you can identify or include what partners or nonprofit organizations or different agencies, public or private, that can help you address those challenges by being part of your activities. And then we have the customizable social determinants of health screening tool. This is a customizable tool that has a question bank from these different screening tools that we mentioned before, but also it gives you the opportunity to create custom screening tools for the social determinants of health factors that are affecting your specific population. It also has a section where you can create an action plan and do an instant follow-up after screening your patient, but also to include different follow-up timelines and other resources that you can add to that specific treatment, we can call it that way, to your patient. And then it also has a national and local resource section. The local section is guided for you to include those agencies or organizations who you can partner in your areas, but also in the national resource sections, we include different resources such as the Bertha, the 211, and other resources that around the United States that you can simply add your zip code and it will give you different resources in terms of social determinants of health factors. Next slide, please. So these are the main challenges and make successes that we were able to identify from our participant health centers. So starting with the main challenges, they pointed out that their patients have been facing inaccessibility to appointments, specifically because of transportation barriers. And we discussed this in the previous section because it is impacting a wide number of patients. And this can be either because of the lack of transportation methods, but also because patients may live in rural areas and they have to drive long hours or to get to the clinics. But also because they have to choose either to go to work or go to the appointments and miss that day of work that translate into income. Also, they have been facing poor health literacy levels, so it is important to have that in mind when we are creating health education content, when we are developing screening tools, or when we are assessing or screening those patients. Access to healthy food, it's another challenge that they faced. The exposure to mold, lead, the lack of social distancing. In terms of housing, substandard housing is one of the main problems, especially now during COVID-19 pandemic, because many of there are housing or housing units that have a lot more than the permitted number of persons in that house, and they are also have to share one or two bathrooms that also translate into hygiene problems. In terms of language barriers, also they have been facing language barriers, the fear of seeking care because of their immigration status. So it is important for us as organizations and health centers to spread the word that you are safe when you are looking for health services in our health centers. So you will not be referred to ICE or to another kind of immigration agencies. And also exposure to hazards like the long periods of time in under the sun, pesticides, also to sharp tools and machinery, among others. And last, cultural barriers that are very important to identify and address them. So by the other side, we have the successes that they had or they reported from their patients. So there is an improvement in the telehealth services, especially now during the COVID-19 pandemic. They were able to improve in those services to reach out those patients that were in rural areas or were not able to come to the health center for their appointments. Also, they have been improving their assistance in filling paperwork for those patients who have lower health literacy or who have language barriers. They were also able to develop programs to improve that health literacy among the patient, agriculture patient population. Also partnerships with public and private organizations, creating and sustaining promotores programs to connect those communities to the health centers. As one of my colleagues mentioned, mobile unit programs are also being put in place, and those mobile units are also being used to go there to those rural areas and to the farms to perform or to give health services in their locations. And also partnerships with schools and colleges to help with the educational level and the literacy. And last, community events on health rights. That is very important also to educate ag worker population for the right that they have as agricultural workers and when they are seeking for health services. Okay, next slide, please. So I am going to share with you in the chat a link for this Jamboard. It is supposed for you to have received it right now on the chat. So I'm going to share my screen also. This is an activity that we want to do with you. Is basically, you have already heard from our partners what the social determinants of health are. So in particular for those that are impacting the migratory and seasonal agricultural workers. With these 4 questions, we would like to hear from you, your experiences, considering your role, the role that you play in your health centers, and what are the current practices and challenges your organizations has faced in implementing effective social determinants of health screening tools to better serve your populations. So I'm going to share my screen real quick. Okay, so please let me know if you are able to see the Jamboard through the chat, or you can mute yourself. Perfect. Okay, so starting with this first question, we would like to ask you, what are the current tools or resources that your health centers utilize in screening for social determinants of health among the migratory and seasonal agriculture worker population? And please link and share this, your links, your resources that you have available. So I would like for you to know that you can either use the text box to write, as I'm doing right now. You can use that, but also you can use the sticky note. As you can see, you press on the left side on the sticky note, so it will pop up a window. You can write in that sticky note, and then you can post it. Perfect. Again, because we have a large number of participants, and we are very glad that we have a big number of participants. You can also unmute yourself and share with us that information, and we can type that for you if it's easier.
Feel free to also add to the chat. That's another option that I put it in the chat option there, Alexis. So yes, we want to encourage everyone to provide us feedback, because I know you heard from our team all the different types of tools available for screening for SDOH. So now we want to hear from you that are working with agricultural workers in the field. Are any of these tools that you're utilizing, or are you in need of tools? What are those current resources right now that you have in place to be able to reach this vulnerable population? Looks like someone has a health assessment created for adults, adolescents, and children. Is that particular to the age group, or is it just one that can be used for all ages? Virginia Garcia uses the AHC screening tool.
Okay. And feel free to unmute yourself if it's easier for you. And we can also, as you share with us your input, we'll be adding that to the Jamboard for you to be able to see it. Okay.
GFCHC has a built-in an assessment into their EHR with prepare questions and some other resources.
Okay, here we have we at Coordinated Care Health Plan have an in-house social determinants of health assessment that all community health workers complete with all individuals that they are able to get in contact. In various topics are discussed with adults. Very good. We also have some other folks that are sharing that prepare and health assessment for adults are built in their EHR, in the electronic health record. Very good.
So it sounds like prepare is a commonly used tool, which we hear often, especially considering how multilingual this resource is. If you recall from our information, it's available in 26 languages. So it's definitely something that can be customized depending on your patient population. We have noted that Spanish is a common language amongst agricultural workers, but one trend we have seen is that we are actually seeing more patients with other languages like Creole or indigenous languages from Mexico. I see a comment here from Teresa saying they identify their social determinants of health amongst agricultural workers, and they've noted transportation or lack thereof seems to be a big concern. Teresa, ¿cómo identifican esos determinantes sociales? ¿Tienen alguna herramienta que ocupan? I was just asking Teresa if there was a particular screening tool that they utilize for that. Feel free to add to the chat if you want. We're happy.
Okay.
So it seems like they have their own tool.
Yeah, exactly. She shared that they don't have a specific tool, so they just observe.
Oh, no tenemos herramienta. That's right. Okay.
Perfect. Very good.
Well, for those health centers that find themselves in situations like Teresa, where you might need a tool, we have plenty, as you can see from today's presentation, available to you. At NCFH, we're also able even to help you develop a customized tool if that's something that you're interested in.
Okay, very good. So we don't have any other in the chat or in the Jamboard. So we think we can go to
the next question.
the next question. So next question is, what has been the main challenge in screening for social determinants of health with this vulnerable population? And where we want you to share is how has your health center adapted or changed social determinants of health screenings due to COVID-19? That's also another factor that we want to know more from you.
I think somebody already mentioned that fear is a big challenge. Workers might be hesitant to report their needs. That is definitely something we've seen. COVID-19 is an added challenge, and that's why we put the second part of that question, because it has affected all of us nationwide, especially agricultural workers. And so, there has been a need to potentially adapt tools in order to follow CDC guidelines and safety precautions. There's a lack of education in rural communities. That's another challenge.
From Teresa, I'm not sure if you already shared that, but she mentioned the lack of access to ag worker camps or farms.
Mm-hmm. Another comment came through, Alexis, about a lack of internet.
Lack of internet. Okay. Remember, feel free to unmute yourself if you want to just share that with us.
Someone mentioned one adaptation during the pandemic is conducting screenings via telephone by CHWs. And that's a great percentage completion by the participant that reported that they have greater than 90% completion. Please share. And that's going to be our next question. So I'm going to invite you to hold that thought and share your success, because that is quite a success to have a 90% response rate.
Here on the Jamboard, someone shared that telemedicine creates additional barrier for open conversations because patients are not as comfortable. Mm-hmm. Okay, we have another one. After screening, resources are available, but sometimes funds are not. Housing funds sometimes are available, but landlords are still not willing to accept low-income households.
Mm-hmm. We had another comment come through, Alexis, about a lack of Latinx leaders or people that speak the appropriate language.
And we have another one here. The biggest challenge that I have seen is evaluating the honesty of the responses in the prepared screening. That's interesting.
Cultural competency is another barrier. Changing phone numbers. And that's common, I think, for this population that's so mobile, especially because they travel, following the season. Also, as we saw earlier, financial challenges are experienced, and a large percentage of this population has income at federal poverty or lower than federal poverty level. So if they are not able to purchase or maintain that telephone available, that's probably something that they lose or will have to reestablish once they're at a better economic situation.
We have another comment here. So social determinants of health staff implementation into our routine workflow. We are trying to include the assessment into our electronic registration to assure increase in assessment completion.
Mm-hmm. Implementing into the EHR can definitely be something that helps. So we'll want to hear a little bit about that success in question 3. We had another comment come through, Alexis, about just a lack of awareness from H2A workers that don't know how to navigate the healthcare system. So that's definitely a challenge as well.
We have another about H2A workers who doesn't necessarily know their addresses. So that's another challenge that they are facing.
Well, I think this is a good amount of challenges, and I'm sure this list is not exhaustive. So we welcome you to continue to add items here, especially if you can access the board. But let's move on to question 3 on those successes, because I'm curious to hear from our audience, in particular about that 90% completion rate. And then anything else that might have added to your success, like a EMR implementation as well.
Perfect. So question number 3 will be, what has been the main successes that you have faced in addressing social determinants of health with the migratory and seasonal agricultural workers, and how has successful screening of social determinants of health decreased those barriers for the ag worker population? We have a comment here. Sometimes perception hinders the screening for the social determinants of health. Sometimes workers get used to and accept things that affect their health negatively. So that's referring to our previous question. So thank you for sharing that.
Let's see if we can try to get, Zach, if you don't mind assisting, we might need to allow our participant to unmute themselves so they can share. One success is that they go actually directly to their farms during the lunch breaks, and when they get out of work, we meet them where they are.
Excellent.
Hi, so this is Judy Gaudet from Generations Family Health Center in Connecticut, and our migrant and seasonal worker program works with 12 different farms in Connecticut, and we average about 400 patients per year that we have that are ag workers. So part of our success is that in 2018, we kind of disbanded our health education department and changed the way we did community health outreach. And we pulled the community health workers in as part of our clinical care teams. And so they're very integrated in the medical department, with the providers, with the care coordinators, the medical assistants, everything. So there's a very well-rounded communication, and the patients are able to utilize the community health workers through every aspect of their medical neighborhood. And as part of that, we built, using medicine IDs and everything, we actually built our own form. And so what I did was took input from the CHWs and said, what is it we need? And then I looked at some of the grant requirements and knew that we needed different things. And so I made that a community health worker form so that they can answer all the questions that they need as far as, outreach questions, country of origin and all of that, but then incorporated another SDOH assessment page. And what that does is it creates a document that is in the patient's permanent health record. So when the provider is seeing the individual, they can actually look at those SDOH forms and see, what are the barriers to care? Is there an issue with them being able to afford or receive medications, or is transportation an issue? And then they can forward tasks to our care coordination team to help apply for whatever services they're able to get, or help set up transportation. And if they're not, and due to documentation, et cetera, if they don't qualify for some of those programs, we have a patient assistance fund in our organization where all of our employees put a certain amount of money out of their paycheck every pay period into this fund. And it is utilized solely for the patients for things like medications and transportation and durable medical equipment and everything, so that we try to make sure that everything they need, we can provide for them, or at least refer them out somewhere. And then during the pandemic, we purchased 200 cell phones so that they had access to that video capability, and we would give the phones out. And if they had a phone but just couldn't do it because it was an international number, then our grant funder gave us SIM cards so that they could just change out the SIM card.
Mm-hmm.
We're having a little problem with the audio. I'm not sure if you can reach a little bit more the microphone.
Yeah, we heard some of that. It sounds like they really do integrate community health workers as part of their program. They also purchased a number of cell phones for agricultural workers to have access to the telehealth. Thank you. There was some audio issues, but I got some of that. So I appreciate you sharing. We have another person that's wanting to also contribute in the conversation. Can we get the next participant, Zach, please? And it's Menda, I believe.
Hi, everybody. Yes, my name is Angel Mendez. I live in Colorado and I work for a federally qualified clinic. And we have kind of like the similar things going on with our migrant workers. We serve about 250 per year. And one of the things that we did this year or 2020 due to COVID was right as soon as they got from the bus, I was right there to receive them with our nurses, just to pretty much screen them for COVID, education about COVID, social distancing, and what to do in case you have, any kind of symptoms, as well as the employers. And for that, it was necessary for me to contact the employers way ahead of time before they arrive so they could be prepared. And it's pretty much everything is about education. I think education in the appropriate language goes a long ways. Right here in Colorado, we still lack a lot of Latinx leaders. It's not like California where there's almost everybody is bilingual. Here it's a little bit different. So we have to accommodate and educate our providers as well, because cultural competency is a huge barrier sometimes, right? So, we are also integrated and we're still trying to knock down those barriers when it comes down to not just health, but also mental health, behavioral health. That is still such a taboo thing in the Latinx community. So we're working very hard on that. And for that, communication is just a big part of it. Yes, I'm sorry, Ezekiel. I'll try to slow down. So what we're trying to do right now, like I said, is meet them right from as soon as they get out of the bus. Then later on, explain to them that we are going to have providers coming in. We designate a specific date, especially for them. So we go to their places, the farm, the orchards. That's where we go. We bring the entire team, and that includes a patient health navigator, a provider, a nurse, behavioral health, and a dentist. So just so they can, and we have sections for them to go, and then of course, before that, we make sure that there's no prior symptoms of COVID related.
Mm-hmm. That is great. And I'm glad to hear everyone's so enthused about sharing, because that's definitely one thing that we want to do, be able to share with each other about what's worked or what hasn't worked. And really, we are here to try to help provide assistance. So that's our final question that we're going to move on to. And this is probably one of those things that we could do to better assist you in gathering information. I saw a comment earlier about how can we get assistance with a customized tool, especially because that's usually associated with a cost. And that is true, but we do invite you to join learning collaboratives. I know at NCFH, Alexis just led our IAC Plus collaborative, and he worked with health centers to try to customize a tool specific to themselves. And that learning collaborative participation is free of charge. It's already wrapped up for this year, but we will actually start recruiting for year 2 soon. And Alexis can speak a little bit more on what his focus will be in the coming year. But we encourage you to participate in these learning collaborative opportunities at NCFH and with our FHN partners, because we also offered that within the FHN collaborative that we had this year as well. So there's resources available. It's just a matter of getting you connected. But we do want to hear, Alexis, feel free to give a brief summary and then gather some questions on this so that we can give a quick overview of our resources and then do our Q&A, since we're about 10 minutes shy of our time.
Perfect, of course. So we are planning for year 2, before moving on to the last question, we are planning for year 2 to start working with cultural competency, health literacy, and language. This year, we went over transportation, food security, and housing. So these factors are going to be covered briefly next year, but we are adding this new social determinants of health topics because they have been very consistent in the feedback that we have acquired from our participants. So it is definitely very important. They are very important topics to work on for next year. So we invite you to go to our webpage, and we're going to share more information on how to get in touch with the National Center for Farmworker Health. So moving to our last question, we want to ask you how us, the National Training or the NTAPs, these organizations that provide these education opportunities for you, how can we assist your health centers in gathering more information and developing resources for you to tackle those social determinants of health or reduce those factors in your communities? We want to hear from you what we can develop for you. How can we assist you? So
yes, is there anything else besides, assistance with customizable tools, like someone mentioned earlier? Any other ways that we as NTAP organizations can offer our support? Feel free to add in the chat, and Alexis can capture that. Mm-hmm. Well, if nothing comes to mind right now, you can just gather that one feedback about customizable tools. We're about to share, and our Teresa, thank you, Teresa, for sharing that MCN also has resources available to that, and she linked that in the chat. So feel free, yes, all of us as FHN members from the Farmworker Health Network are available and can provide information to you. Okay, so we're gonna go ahead and go back to the last part, which is those additional resources. As Alexis mentioned, we have some specific ones available on our website at NCFH that you see here. And not only do we have information on social determinants of health, we have a number of different resources that you can gather. And if you'll go here, Learning Collaboratives is one of them. Alexis, can you drop that hyperlink in the chat, please?
Sure, I will.
So then people can have that information. But we encourage you to explore our website. As you see here, we have a number of patient education materials, digital stories. Alexis is actually gathering information now to launch an SDOH hub, which is a specific page just for social determinants of health. And so that will be coming this summer. So be on the lookout for that. We encourage you to sign up to join our newsletter so that you can receive notifications of any new products and events that we have available. That's a great way to keep in touch with what we have going on at NCFH. And as always, we encourage you to join our efforts with the Ag Worker Access campaign. I'm sure you've heard this mentioned in some of the plenaries already about how the campaign was launched in 2015, along with our FHN partner, the National Association of Community Health Centers. And we just want you to be a part of those efforts in us advocating for agricultural workers across the country. So please sign up to join that movement and be a part of the campaign. So with that, I'll pass it to my colleague, Teresa.
Thank you, Gladys and Alexis. And thank you to all of our faculty. I think I may have a trouble with my video here. Hang on a second. Sorry. So again, I wanted to thank you, Gladys and Alexis, and thank you to all of our faculty for sharing your expertise today. As a reminder, please enter any questions additional questions that you may have in our chat. We'd love to hear from you and answer those questions. All right, well, I'm not seeing any additional questions. You have our email addresses. Please feel free to reach out to us. We'd love hearing from you. And we want to thank you for coming to the SDOH panel session today. We've enjoyed spending the afternoon with you.
I want to go ahead and just direct everyone. I'm about to put in the chat the survey link to today's presentation. So please, if you have a minute to go ahead and fill that out. I'm entering it now so that we have it. Your feedback is very valuable to us, and it always helps us when we conduct trainings like this so that we have information from you and can better tailor our training services in the future. So there's the link right there. Please go ahead and complete the survey and give us your feedback so that we have that information available.